Greetings and welcome back. I had a football player I was working with, and he was tired and lethargic, out of energy. And I took his diet, and he was a traditional American football player. He was a carnivore. And as we explored some of his dietary habits and the medications he was taking, looked at his blood work, and he was profoundly anemic. He had iron deficiency anemia despite eating large amounts of animal protein. Well, how did that happen? He had an alteration in his digestive tract because he was taking a lot of pain medication. So in this lecture, we're going to integrate the normal process of digestion, the way your body's supposed to behave, with the most common digestive disorders. Now, nutrition is a key player when it comes to discussing digestive health, and what we eat can make a difference. With many of the disorders we're going to look at, there may be no cure per se, but rather than control through nutrition and dietary choices, lifestyle changes, and again, possibly medication. I'm going to start out and orient you. We're going to divide the digestive tract into two sections, the upper GI and the lower GI. And in the upper digestive tract, we're going to look at the mouth, the esophagus, and the stomach. So let's get started. Let's start taking a look at oral diseases. Well, nutrition does begin in the mouth. We know that saliva is required for digestion and for moisture. In conditions such as radiation for head and neck cancer, saliva can be compromised and the food must be moist. Because when you lose the natural ability of saliva to moisten food, you're going to have to replace that moisture with moist foods. This might include things like applesauce, soups, mashed potatoes with gravy, and yes, I did say gravy, or margarine. What we're trying to do is integrate the disease with, again, replacing some of those missed substances like saliva with moisture in the food. Now, what about dysphagia? Dysphagia occurs when there's a disruption of the normal swallowing mechanism. As food passes through the esophagus, there's a complex mechanism to make sure that the food is propelled into the esophagus rather than into the trachea or the windpipe. Sometimes food accidentally makes its way to the trachea, probably due to an incomplete closure of the vocal cords. For most of us, this is occasional and it's uncomfortable, but it's the experience of choking on our food. Now, when this becomes chronic, it's not the occasional episode, but when it becomes chronic, it is called dysphagia. And it can occur when any step of the swallowing mechanism is disrupted. When the food ends up in the trachea, you're breathing in your food, aspiration pneumonia can occur, and it can be life-threatening. Some of the most common causes would include stroke, head injury, and Parkinson's disease. Well, how does nutrition help here? Think about this. Liquid foods leave your mouth quickly. If the nervous system is disrupted, like in stroke, liquids are going to be the most commonly aspirated food. So what can we do to prevent that? Well, there are special thickeners that exist to thicken commonly enjoyed liquids, such as coffee, milk, and juice, without ruining the taste. Again, in healthcare, we always have partners, and in dysphagia, speech therapists and speech pathologists can assist in the swallowing mechanism and actually can help patients to develop positional changes, changing the way their head is when they swallow, which can aid in the swallowing response. Now, after food reaches the stomach, it is acidified, and this is so key, and we've covered this in the lecture on digestion. If the acidified stomach contents reflux or backwash into the esophagus, we have what is known as gastroesophageal reflux disease, and you see this advertised in magazines and in television as GERD. Now, your stomach is protected against acid, but the soft tissue of the esophagus has no such defense, and you can experience a burning sensation in your chest that we call heartburn. And actually what it is, it's the acid that is backwashing into that soft tissue and causing pain and irritation. Many causes of GERD include changes in the pressure of the lower esophageal sphincter, known as LES, and our bodies are designed with a series of one-way valves to help food go south, and the LES is one of the first valves that we encounter. So an example here might be a hiatal hernia, where there's changes in that esophageal sphincter pressure. Normally your stomach is below your diaphragm, but when it protrudes into the thoracic cavity, GERD can occur. There's less of the ability to keep that LES closed, and so what ends up happening is that there can be a leakage of stomach acid on a continual basis. This is because of the protrusion of a portion of the stomach into the thoracic cavity after passing through an opening in the diaphragm. Now, sometimes an unthought of consequence or cause of GERD is obesity, particularly central obesity. Remember that central obesity is the fat that accumulates in our abdomen. Another common cause, but uncommonly thought about, is your clothing. If you wear tight clothing around your midsection, or if you pull your belt tightly, you can put undue pressure on that LES and cause reflux. Smoking can alter LES pressure and also contribute to GERD. So again, we're talking about some environmental or lifestyle changes that you might want to have. Now, managing GERD centers around the reducing acid production and preventing the reflux. It is usually recommended that individuals with GERD consume a low-fat meal, as a thought that fat helps to delay gastric emptying time. The food hangs around too long, more likely to reflux. Although food affects each one of us differently, if you suffer from GERD, you may want to wish to consider avoiding some of the following foods. Many of these recommended food omissions are due to either effect on gastric secretions and or LES. Common offenders include chocolate, onions, juice and carbonated beverages, peppers, mustard, tea, and real peppermint or spearmint. So think about this. Many people take peppermint candies in order to minimize GERD, and actually if it's real peppermint, it may actually make it worse. Coffee may or may not be a culprit. Although research has not shown that coffee is a risk factor for GERD, sufferers are often advised to avoid coffee consumption, primarily due to the amount of caffeine in coffee. Eating high-fiber bread rather than low-fiber white bread can significantly reduce the risk of reflux. Why is that? It's promoting that food leaving the stomach a little faster. Alcohol shows no real significant difference in GERD symptoms. However, many individuals will find if they have alcoholic beverages, their symptoms deteriorate, or they have enhanced symptoms. And the bottom line is, if it bothers you, don't eat it or drink it. Other lifestyle strategies to try for GERD include losing weight, regular physical activity. Avoid the known gastric irritants as well as those that bother you. Eat small meals to reduce pressure on LES. Eat slowly enough to allow adequate transit time for the food. Sleep with the head of your bed elevated to keep the stomach contents where they belong in the stomach, particularly if you have a hiatal hernia. And control your intake of aspirin or nonsteroidal anti-inflammatory drugs. Well, what about medications? Are there medications that you can use? And certainly antacids and medications designed to reduce acid production are popular. But I want you to think about this. Any medication you take chronically may have a nutritional complication. So in the case of antacids, buffering the stomach can reduce the acidification. That actually does improve the bioavailability of thiamine and iron. So thiamine and iron must be acidified to be absorbed. Bacteria also that we all eat in our food are more likely to grow and survive in this more neutral or buffered pH. Some of the medications that are used actually have the potential to reduce the risk of the release of intrinsic factor, which is needed to unlock vitamin B12 from food. So again, any medication you take chronically may have a nutritional complication. Now we get to the stomach and to ulcer diseases. Symptoms include burning stomach pain, black tarry stools, nausea, vomiting, indigestion, heartburn, and weight loss. Now, ulcers can occur both in the stomach and in the small intestine. However, the dietary and nutritional management for both are similar. So what causes ulcer disease? H. pylori is a bacterium, and early in my clinical practice, ulcers were thought to be solely caused by stress or poor diet. As such, the thought was we'll coat the stomach and protect it from acid. And this diet was called the sippy diet. It consisted of cream and milk. And as the science evolved, bacteria emerged as the major cause of ulcer disease. And it causes 90% of this disease. Sometimes ulcers can be secondary to other diseases. For example, if a person has need to take nonsteroidal anti-inflammatory drugs, say for example, significant arthritis. So arthritis may be the disease that now contributes to ulcers because of the role of these medications on stomach lining. Actually, what will happen is the lining of the stomach fails or weakens and allows the acid in the stomach to erode the lining. And that's actually what happened with my football player. Treatment when it's H. pylori must include antibiotics and, again, avoidance of medications that might contribute to the erosion of stomach lining. Now, certainly diet can be supportive and aid in the healing process. Each patient has a very individual diet, but some nutritional choices that might improve this condition include: avoid consuming large meals to reduce acid production. Consume soluble fiber that helps to normalize gastric emptying time. Soluble fiber also stimulates what is known as the production of short-chain fatty acids, which are associated with actually the regeneration of that damaged mucosa. Consuming omega-3 fatty acids and omega-6 fatty acids, they may also help to regenerate mucosal cells. Keep in mind, omega-3 fatty acids are most commonly associated with cold water fish. Now, there may be some things to avoid. Peppers have been shown to increase acid secretions. Coffee and caffeine may also do that as well. But the bottom line is, if it causes you individual distress, avoid it. Now, as we move on down the GI tract, we actually come to the lower GI system. There are many diseases and conditions that affect the small and large intestine. In this section, we're going to cover the following disorders, as they are often the most common. And they include irritable bowel syndrome, lactose intolerance, celiac disease, which sometimes is referred to gluten-induced enteropathy, and diverticular disease. So let's examine irritable bowel. Some of the symptoms are abdominal pain, chronic diarrhea, or chronic constipation, and sometimes these are alternating, so you actually get a combination of both of them. Well, what causes it? Well, if you're looking in the medical literature, the word that you're going to see is visceral hypersensitivity, but sometimes I just refer to this as fussy gut. You feel more discomfort with the presence of gas in your GI tract than normal. You feel more sensation associated with the presence of food in your intestine. So again, you actually have a hypersensitivity to food as it transverses through the intestinal tract. Certainly individuals with irritable bowel can have altered intestinal motility. Sometimes it's faster, sometimes it's slower. They can also have the abnormal transit time of gas and stool. Sometimes it's fast, sometimes it's slow. Another contributor to irritable bowel is stress or chronic anxiety. And so I would think in most of our lifestyles, we do have some degree of stress and anxiety. The problem is, as with many GI disorders, irritable bowel can oftentimes be confused with a dietary or a lactose intolerance. Celiac disease, again, an intolerance to gluten in foods, may be confused with irritable bowel, or actually maybe the actual cause of irritable bowel. So what kind of treatments exist for irritable bowel? Well, sometimes you can consume a lower fiber diet if diarrhea is the presenting symptom, and a higher fiber diet during periods of constipation. You eliminate the foods to which the patient is sensitive, and this comes up over and over again. If you think, well, every time I eat fill in the blank, I end up having problems with my gut, then you might be sensitive to that food just because you're you. And a way to manage this is you might want to think about keeping a food diary to track foods along with symptoms to see if you can figure out what's unique about you. Certainly things like probiotics, such as yogurt, might be helpful, and we cover that topic in another lecture. These are foods with healthy bacteria that can help to balance gut function and normalize bowel motility. And in my practice, I find that's a really very viable solution for many, is to try probiotics. Certainly, since stress may be a cause, lifestyle changes Might be recommended to lessen the stress. I have a lot of patients, for example, who participate in yoga that have irritable bowel. And again, as with most chronic GI disorders, medications may be prescribed. So I want you to think, if a medication is prescribed, ask the question of your pharmacist, is there a nutritional consequence of this that I should be aware of? Now, what about lactose intolerance? This is one of the most common conditions, and it can affect people of all age groups, but it is more common in African Americans. Now, what are the symptoms? Discomfort after consuming milk products, and it's usually within a couple hours of consuming milk products. And it can cause nausea, cramps, bloating, gas, and diarrhea. So physiologically, what causes this? Why do you have a lactose intolerance? It is an insufficiency of lactase. And you remember from the lecture on carbohydrates, lactase and digestion. Lactase is the enzyme that helps you to digest lactose. It can also be caused by an infection or an inflammation of the intestinal tract. Or it can be a secondary to another disease, including anything that's going to damage the villi in the small intestine, such as occurs in celiac or Crohn's disease. Remember that lactase enzyme is going to sit on the tip of the villi, the absorptive part of your small intestine. And if you have any damage to your small intestine, the lactase enzyme can temporarily go away. So what's the treatment? Being somewhat deficient in lactase is normal for most people. However, most of us can tolerate, even with a mild lactose intolerance, up to a cup of milk or 12 grams of lactose per day. Research shows that avoiding milk will probably make individuals less tolerant to consuming milk products because the bacteria in the colon never learn to adapt to it efficiently. And again, when you demand that your body make lactase, your body's going to respond up to its biological capabilities. Now, there's some key points here. You can buy reduced lactose products in the dairy section, or you can take over-the-counter lactase pills. They can be placed in the liquids to counteract the lactose before the consumption, so most symptoms are not felt. But timing is everything here. So if you decide to take the lactase pill 20 minutes after you had milk, you've waited too long, and that's actually too late. Those individuals avoiding milk may actually need to take a calcium supplement, because remember, you've created a nutrient hole because you've eliminated a food group. Note that fermented products such as yogurt are better tolerated because they have the enzyme lactase in the food, and that's actually produced by that wonderful probiotic bacteria. Now, what about celiac disease? Celiac disease patients are sensitive to gluten, and gluten is a protein in grains such as wheat, barley, and rye. It is thought to be one of the autoimmune disorders. In fact, those with type 1 diabetes, another autoimmune disorder, are more likely to develop or have celiac disease. Some estimates indicate that celiac disease is underdiagnosed, and the actual prevalence may be as high as 1 in 133 people. So this is one that if you have one of those things that we call fussy gut, you may actually have undiagnosed celiac disease. Symptoms may occur in the digestive tract or in other areas of the body. Infants and young children are more susceptible to the digestive symptoms. Adults may experience iron deficiency anemia, osteoporosis, and an actual skin condition called dermatitis herpetiformis. What causes it? Well, certainly we know that with celiac disease, there is a genetic predisposition. Prevalence is higher in relatives of persons with celiac disease. So if someone in your family has it, you have an increased likelihood because of the genetic predisposition. Consumption of foods containing wheat, barley, and rye causes irritation and discomfort. Actually, what the gluten does is it damages the villi in the small intestine. Now, studies show that oat consumption is a little bit more controversial. Some studies are going to suggest that yes, if you consume oats, you may have some exacerbation of your gluten intolerance, and other studies say no. When individuals with celiac disease eat gluten, their immune systems attack and damage and destroy the villi in their small intestine that help their body to absorb nutrients. So again, remember, this is an autoimmune disorder. For a true diagnosis, you have to have a biopsy of the small intestine to test for the presence of certain antibodies. 50% of celiac patients, however, have few or no obvious symptoms. So what's our recommended treatment here of celiac disease? 100% gluten-free diet adherence. If you're able to do that, and again, manufacturers have made this so much easier in the last few years, they label products gluten-free, not just wheat-free, but gluten-free. If you're on this gluten-free diet, most major symptoms are going to disappear within 2 to 8 weeks. And what's happening is the villi in your small intestine are actually regenerating. Read labels to avoid things like wheat, rye, or barley. Check labels on seasoning. And oftentimes you're going to have to actually call the food company for a clarification. Again, please remember, wheat-free doesn't mean gluten-free. Damage to the villi in the small intestine, this diet may make you deficient in other nutrients. So again, think about it this way. If I'm eliminating grains, I may be eliminating, for example, magnesium, other minerals as well. So here are some strategies. Have adequate calcium and vitamin D in your diet to prevent osteoporosis and osteomalacia, which is also known as adult rickets. You may need to increase the amount of iron in your diet to account for the exclusion of iron-fortified foods made with wheat, rye, or barley. Include folate-rich foods such as fortified breakfast cereals, but again, remember, you want to stay away from those that are going to be made from suspect grains. So maybe you want to have a fortified rice breakfast cereal. And again, you could also go to green leafy vegetables as a source of folate-rich foods. Because fatty acid malabsorption can cause a decrease in the absorption of fat-soluble vitamins, focus on foods rich in these nutrients to include cantaloupe, carrots, nuts, and seeds as tolerated. Some patients may find that a low-lactose diet might be useful in controlling symptoms at first. Keep in mind, once the GI tract returns to normal, though, you should always try and add back a little bit of lactose. So again, celiac is an example of a disease where, due to damage to your small intestine, you can develop a temporary or a secondary lactose intolerance. Now, what about diverticular disease? Diverticular disease and diverticulitis is actually an inflammation of the diverticulum. So we're going to explore that in a little bit more detail. Some symptoms are abdominal pain, particularly tenderness in the lower left side. Well, what causes it? It's caused by the infection of the diverticula. And what are diverticula? There are little outpouchings in the intestinal tract. So if the lining of your intestinal tract is supposed to be smooth, when you have diverticular disease, you get a little bit of an outpouching in the wall of that intestinal tract. And as it outpouches, what ends up happening is food can get trapped. It's often thought to be associated with constipation. So if you are constipated and you bear down or strain to have a bowel movement, the increased pressure in that intestinal wall can cause an outpouching in the intestinal wall. So again, this is oftentimes associated with our traditional American diet of highly processed foods. So if you think I really would like to prevent this disease, this is where eating whole grains and a lot of fruits and vegetables and the avoidance of constipation is really pretty key. Keep in mind, we've talked about constipation in another lecture, but I'm going to remind you, constipation can be caused by inadequate fiber, inadequate hydration, and poor exercise habits. These diverticula then can oftentimes be obstructed by fecal matter, causing inflammation and pain. And if it ruptures, it can actually spread bacteria into the peritoneal cavity and cause a true bacterial infection. Well, what are the treatments? In the acute phase, the phase with significant amounts of pain, antibiotics are going to be one of the mainstay treatments for diverticulitis to reduce the inflammation. Oftentimes, as part of that recovery, you might want to begin with a low residue diet. And keep in mind, residue means anything that is not completely digested. So certainly fiber would contribute to residue, but other foods such as milk that are not completely digested may also contribute to residue and would be avoided on a low residue diet. So you may start out there, but then you're gradually going to return to a higher fiber diet to again prevent the constipation. This high fiber diet may promote soft, bulky stools that require less straining. With less straining, there's lower intracolonic pressures. And for patients who didn't have a high fiber diet before, please always know that you have to gradually increase the fiber in your diet. This is an example where you can't go from low fiber to high fiber because you can have significant GI upset. Certainly ensure that there's an adequate amount of exercise and get adequate amounts of fluid to avoid that constipation. And if you are sensitive or you experience pain with nuts and seeds, keep in mind they can get trapped in that diverticulum and cause inflammation or irritation. Avoid them if you are sensitive. Now, certainly there are other GI disorders, and so in our frequently asked question, one that I hear quite often is, my daughter has been recently diagnosed with Crohn's disease. What is it, and where can I find out more about it? Okay. Keep in mind when you search the internet, there can be unbelievably reliable sources and some not so much. So what is Crohn's disease? Crohn's disease is an inflammatory bowel disease. In Crohn's disease, all of the multiple layers of the intestinal tract become inflamed. As such, the intestinal wall becomes damaged and also causes the malabsorption of vital nutrients, along with significant diarrhea. Now, here's an example where diet is supportive, but it's not curative. It is not curative. So many people who have Crohn's disease believe if they follow a prescribed diet, that's going to cure Crohn's, and unfortunately, I think we're years away from a cure. Now, to find out details about Crohn's and other digestive-related diseases, among your best sources on the web is the National Institute of Diabetes and Digestive and Kidney Disease. It's going to give you details about the disease, including symptoms, how it's treated, and other useful information. Another concern about Crohn's disease is as the intestinal wall becomes damaged and becomes inflamed, oftentimes there's a narrowing of that intestinal lumen or tube, and oftentimes individuals have to have bowel resections, or they may not be able to tolerate high fiber foods. So this is a great example where you must partner with your physician. And again, with Crohn's as well as other kinds of GI disorders, oftentimes medications are going to be part of the mainstay of treatment. Another frequently asked question. I've always heard that I need to increase the fiber in my diet and to do so gradually. But how do I do this? Well, certainly fruits and vegetables are an easy fix, and here's an example. If you normally have orange juice in the morning, maybe what you want to do is have a sliced whole orange. Or if you're hard pressed to give up that orange juice in the morning, maybe you purchase one with a higher pulp content. Fruits and vegetables are going to be an easy way to add more fiber to your diet. Another thing that you can do is choose high fiber breakfast cereals. But again, because they have so much fiber per serving, here's a tip for you. You take your regular breakfast cereal, the one that you've grown up with and love, and you add a couple tablespoons of the high fiber breakfast cereal. You're enriching it with fiber, but you're not going from 0 to 60 in your fiber intake. As your body becomes accustomed to it, every few days, add just a few more tablespoons, and maybe you get to a point where you're looking at half of your regular cereal and half of your high fiber one. Keep in mind that nuts are also going to be a great source of fiber. Whole grains are a great source of fiber, but bodies need time to adapt. So one of the biggest barriers I see in clinical practice are individuals who go too quickly. They switch from their regular morning breakfast cereal to a high fiber version. They're on it for a day or two. They have significant GI upset, and they think, my gut can't tolerate this. And my response is, yes, it can, but you gave it too much too quickly. And again, remember your digestive tract is this wonderful complex machinery, but it needs time to adapt to something new. A companion question to that is, what about fiber supplements? Aren't fiber supplements beneficial? Can I just go to a pill? And I always say, be careful with the fiber supplements. Keep in mind, a lot of fiber at a particular meal, particularly in a supplement form, can alter your body's ability to absorb many minerals. So that would be the first concern that I would have. If you're using a fiber supplement for constipation, have you explored the other causes of constipation? Are you dehydrated? What is the color of your urine? Remember, if your urine looks like pale lemonade, you're probably hydrated. If it looks like apple juice, you're not. So the real tragedy that I see is individuals can take a fiber supplement without adequate amounts of fluid and actually make their constipation worse. Also, you want to think about the type of fiber supplement. If you're really trying to treat constipation, bran is going to be better than a commercially available supplement that has psyllium in it. So keep in mind, bran is going to be great. You can go to your health food store and buy bran very inexpensively, and you could add bran to applesauce. You can even add bran to mashed potatoes. But remember, go slowly for the best GI outcome. And thank you very much.